Hey y'all, happy Wednesday, and it's time for another round of In the Hot Seat. So I'm super excited for our guest today, and I'm like all over the place. I'm super excited for our guest today, and I'm just gonna go ahead and bring her up. We are gonna talk to oh, I had to completely mess it up. We are gonna talk to Dr. Beckford of You Are Caring Doc. So I'm gonna go ahead and bring her out so she can tell you more about what she does and how this helps. All right, I'm bringing you
Hello,
up. I just like completely
hello,
forgot
everyone.
everything, but I'm excited.
I'm excited also.
Well,
Thank
first,
you.
you're welcome. Well, we'll go ahead and just get started, and you can just go ahead and introduce yourself and let us know what you do.
Absolutely. So I'm Dr. Tamara Beckford. I am the CEO and founder of Your Caring Docs. So Your Caring Docs is a telemedicine urgent care. So telemedicine urgent care, what that is that it allows you to see your doctor quickly, right? Through video, like what we're doing
Right.
now. So you can see your doctor, especially because I said it's an urgent care. So we can see for urgent care issues, such as your urinary tract infections, your flu-like symptoms. Even now during this time, there are a lot of people who have like COVID-like symptoms, especially if you've gone through like a drive-through COVID
Mhm.
testing center, right? You've gone through the drive-through COVID testing center, you've tested positive for COVID. Your symptoms are mild, but it's still a discomfort to you, right? So you don't need to be
Right.
admitted to the hospital or anything. You haven't seen a doctor because it was just a drive-through center. Yeah, we can take care of people with those type of symptoms, get you some medication to get you feeling a little comfortable and also to educate you. So, telemedicine urgent care is a very convenient way for you, especially this is a mom's group, moms mobile. Moms, we know how it is. I'm a mom.
Yes,
I have two young
Lord.
boys, 2-year old and a 4-year old. So we know how it is. Packing them up and trying to take them out of the house in order to get some minor care. And that's what your Caring Docs is here for, to help to alleviate that part of your burden. So, in addition to that, we help small business owners. We have a lot of moms who are business owners also. If you are unable to provide health insurance to your employees, then this is an option that you can let them know, hey, this resource is here for you. It's very economical, and it also helps to keep your employees healthy and to reduce their time having to leave to go to the ER, sit, wait hours and hours for something that can be taken care of in the convenience either of their homes, even in their car, because like we said, this is through video. So we can take care of
Right.
you anywhere. Yeah. So that's where we're here to really provide excellent care for you and your family. So I guess you want a little bit of my background. Like, well, why would you want to use Dr. Beckford? Like, who is this person? So I am a board certified emergency physician. So I've been practicing emergency medicine for over 10 years. And I was trained in Philadelphia. And from Philadelphia, I moved to Houston, Texas, and been practicing emergency medicine here in the Houston area during that time. If you're trying to figure out, like, way back, went to med school in New Jersey. In Newark, New Jersey, the med school has changed its name. It's now called Rutgers New Jersey Medical School. So it's a Jersey to Philly to Houston combo. The story, goes
Okay.
on and
Yeah.
on. Yeah, exactly. So I'm really here and I can provide care to, our patient population in Texas and also in New Jersey. Yeah,
Okay,
so,
awesome. I was just about to ask you that. I was like, so is it just certain areas? But okay, got it.
yeah. Hmm. Yes.
That's awesome. So, like, what made you like finally come up with like the concept? Like, I know you said just like having young ones and everything, like the virtual. And would you, for people that are on the fence about using a virtual doctor, what would you tell them that to kind of like alleviate their stress? Some people like to be in person, even though it may not be the
Absolutely.
best thing for them.
Right, right. No, and that's a great question. That is an excellent question because it takes a while for you to really connect with someone and you have to feel comfortable. So I always tell patients who are, a little bit hesitant, and I said it's okay. I'm not going to be offended if you're hesitant to use an online doctor. The most important thing that you need to know is that it exists. The option exists. So if you come up and it's in a bind, you can't get in contact with your own doctor. It's a Friday afternoon, right? Doctor's office is
Yeah,
closed until Monday. This is something that you
right,
would like to get taken care of, but you don't want to leave your home. You don't want to go to a physical urgent care facility, and leave your house. Is something that you can just happen to hop on and get it handled within 15 to 30 minutes. The option exists. Your medications are
right,
sent electronically to the pharmacy. So I don't say, I don't get upset or anything. I'm like, no, it happens. It's okay. Do it when you feel comfortable, but also know that it exists because there's going to be a time when you're in a bind and you need to be able to say, you know what, I can get in contact with this person, I can
right.
see them, they can provide excellent care, and I can move on with my day. So know that it exists. That's my biggest thing, and know that the option is there for you.
Awesome. So, of course, I have to ask, do you plan on have like okay, so for the I can't talk. The virtual appointments, are you the only doctor or do you have other doctors that work with you?
So for now, I'm the only doctor. So what you're seeing here, it's me. It's me and all my personality. I love taking care of
Awesome.
patients. And yeah, that's me, So it's me on my personality. Do I plan on expanding? Yes, I do. But I do want to set the groundwork and the framework for the company and its excellent business and provider care. And so we start out that way and then we'll expand afterwards.
Makes sense.
Mhm.
That makes sense. Do you have any projects or anything coming up this year that we should be aware of?
Well, yes, projects I do want to let our one of the things I do love to do is to educate. I love to educate our patient population. I think it's very important for you to understand what's going on in your body so that you can make great medical decisions. So what I do, some of my projects, as you mentioned, is every Friday I do a Facebook Live on the Your Caring Docs Facebook
Okay.
page, and with that, we go over, generalized medical topics. I explain it and break it down so that everyone can understand what's going on. Break down the highfalutin medical terms. Like, oh, well, I
Yeah.
want you to be able to converse with your doctor, or when you hear things about either you or a family member, you know what's going on because you can visualize it. And so that's something that I do every Friday. So there are lots of videos that's also on our YouTube page. You can go there and
Okay.
look at all the different topics. We've broken down topics like stroke, high blood pressure, what a heart attack is, just kind of understanding what's going on, COPD, asthma, it goes on and on and on. I love doing it. So those are things that you'll always
I can
see.
tell.
Yeah. In addition, I also, did information on the COVID. Information on what COVID is, how it affects the body. I have this thing called the COVID Toolkit that I just kind of go over some of the main things that you can have in your home to help to alleviate some of the symptoms of the COVID virus and to know when it's
Okay.
important to go to the emergency room, because all of this is important. We're all dealing with this. You're feeling crappy, you're at
Right.
home, you've tested positive for COVID. Should I get up and go to the ER? Or, is this something that I can manage at home? I have that all also on the page, and I've made a little newsletter, to provide for those who want it, just so you can just have it at home. Know what's going on
Okay.
and to be able to
Yeah.
make great medical decisions.
That is super helpful. Do you have any other like little toolkits for people? I know that COVID toolkit is definitely a high must for like the share. So I'll make sure I let some people know about that.
Absolutely. Absolutely. Yeah. I mean, and I'm open to if people want to hear more and learn more about any other topics, absolutely. They can always just go to the Facebook page and leave a message like, "Hey, Dr. Beckford, I want to learn about blank." And I will put together a video. I'll also try to bring on, just like you're bringing on guests to really, to help your patient and the population, my patient population, to understand what's going on. You're bringing guests on to help your set of, followers and mom moglers know what's going on. We definitely will, provide that information. I'll bring on some specialists to break things down because I want everyone to know what's going on. If you know what's going on, then you're more likely to make better decisions, right? So that's very important
Exactly.
to
Okay, I've got one last quick question. So, most of us have kids. What kind of tips would you give us to kind of like stay healthy or like, I know healthy eating, but like any particular things we should probably take a little extra of just to kind of stay healthy through these rough and interesting times?
Sure. So vitamins. All right, let's talk about like some vitamins to just keep us going. One of the most underestimated vitamin that's out there is vitamin D. Like a lot of people don't realize like we need to, and if we think about how we are, right? We're stuck in a house. We
Right.
get our vitamin D normally from sunshine and, breaking it down into our bodies. We're not getting that. And they're finding out too that vitamin D's help with building immunity, right? So I would say that
Mm-hmm.
I know we all love our vitamin C, we love our zinc, but let's not sleep on vitamin D. So add that to our
Okay.
regimen. That'll help. It helps with mood enhancement. It helps with like even depression. Have been noted. Yeah, vitamin D. It's a little vitamin that we've really not been highlighting as much. Now, other than that, I think it's also important spending time with kids. It's challenging, right? We're kind of like stuck. We're at home, a lot of us, or you're balancing home and work. And, our kids are a part of the whole scenario. And it's just like, I don't know about you guys, but let's talk about mom guilt, right? It
Yeah.
exists. Yeah, so one of my colleagues, she has this thing called, she calls it Me Tweak, which she does, and it's called Meaningful Time with Kids. Dr. Una, she gave that. I love that Me Tweak. So what she does, which I've started to incorporate, is that she carves out a little time, say if it's like 30 minutes, and say you have the two kids, you try to give them a little bit of individual attention each, like 15 minutes to one, 15 minutes to the other. And so they get that
Yeah.
individual time. They can really express what's going on, how they feel, and you get the meaningful time with the kids and they get the meaningful time with mom. So that's one thing that we're trying
Right.
to incorporate. And it takes a while. It's not going to just happen just like that, especially if you're not used to it. But the more you work on it, you'll both see the benefit, you and the kids. So that's my little thing. The little me tweak.
I like that. I like that method. And I was like, I need to be more mindful. That's something I'm working on this year too. Like being more mindful of how much time I spend with them and actually like giving them their one-on-one time. I'm home all day with my toddler, and then my 7-year-old comes in. It's kind of it just breaks
Absolutely.
apart.
Yes, yes, no, we see it. And we all struggle with it. Professional moms, everybody struggles. So this is something that we all struggle with. So we're all working and we're all going to get better.
Thank goodness. I'm glad people like can relate. But the last thing I want to
Oh,
ask you,
yeah.
where can we find you online
All
or
righty.
your favorite
So you
hangout spots besides? Oh, sorry.
Yes, absolutely. So for our all of our mom moguls out there, as I mentioned, I do have the COVID Toolkit newsletter. So you can find me at the You're Caring Docs That's the URCARINGDOCS, kind of like here on this URCARINGDOCS. We have it there
Love
on
it.
the sticker.com. And if you go to the blog, you'll see the link to sign up for our COVID Toolkit newsletter. We'll love to have you to, provide this great info for you to have for your family, friends, let them know. And of course, we're also available on the Your Caring Docs Facebook page every Friday, where we provide some great live. So don't forget to sign up for the
Awesome.
Toolkit,
Well,
guys.
yes, I will make sure I put that in the caption as well to make sure to download and
Absolutely.
where to find that.
Yes, I'll send you the
So
link so that
just
you may
again,
have it.
okay, awesome. Sounds good to me. All right. Did you have any last words before we tell everyone good night? Or
Well,
I
I
guess
do.
if you're watching the replay, or
And tell everyone goodbye. I know, right? Well, one of the things that I do want to do, I do want to thank you for having me on. This was wonderful. And all our mom moguls out there, we're all in this together. I just want all of your audience to know we're in this together. We're working and we're figuring it out and we're doing it together. So it's great to be able to have a positive space to express yourself. And so I really appreciate you having me on to have this positive space. And it's a loving family space to express some of the things and the projects that we as mom moguls are trying to do. We're all working in this together and we're all going to
yes,
do it. Yes. So thank you for having me.
of course. I'm glad to talk to you. So that was actually really informative. So vitamin D, that's definitely going to be on my to make sure
Don't,
I'm taking it
yeah,
up.
we said don't sleep. Don't sleep for vitamin D.
Yeah.
Yes.
All right, you guys, there you have it. So make sure to download the toolkit. Y'all know I have all the information in the caption. And you guys have a wonderful Wednesday night. Or if you're watching a replay, y'all have an amazing day or night whenever you're watching this. So good night.
Good night.